the launch of the Perinatal Planetary Health Assessment Tool. This has been a super long time coming. When I say a long time coming, objectively not that long. It's been for the last 2 years we've been working on this. But before we start, I want to let everybody know that I am coming to you guys from Treaty 1 territory, the lands of the Anishinaabe, Cree, Oji-Cree, Dene, Dakota, and the birthplace at the Métis Nation. And one of the other things we want to mention is because this project came to you guys through the Canadian Association of Nurses for the Environment, CANE as an organization commits to righting the wrongs of colonialism by strengthening our knowledge of and relationships with Indigenous peoples where we live and work, and by adopting decolonial and anti-racist practice and discourse. Therefore, we strove to integrate these elements during the work we have done in the PERIPHAT. So objectively, when we were working with the PERIPHAT, one of the reasons we chose the planetary health framework was because it was grounded in Indigenous knowledge. Other examples of how we tried to walk on the path of reconciliation was by actively seeking experts with lived experience from equity-denied populations, prioritizing Indigenous populations who face a disproportionate impact of climate and planetary health inequities. We asked these people to review the data synthesis tables and as well the PERIPHAT tool in the end. We were also, when we were seeking the experts for the Delphi panel, we made sure to provide an honorarium and remuneration for the feedback provided, given how long of time it would take. We also sought counsel regarding which land-based foods to incorporate in the various regions in Turtle Island for the food and water security portion of the tool. And we also tried as best we could to incorporate and highlight Indigenous scholars, researchers, and resources within the PERIPHAT sections when available. Going forward in this project, we are seeking to develop partnerships with various organizations, including Indigenous communities. For example, we are working on obtaining research license in Northwest Territories and Nunavut. And to do that in a good way, we're taking the time to really build those relationships and partnerships with the communities to see how the PERIPHAT can apply to them. We also want to ensure that we receive feedback from healthcare providers and community health workers from as many different communities as possible, while prioritizing voices that are not often included in research studies. That is one of the reasons why I'm very happy to see all of you here today. And to start, I do have to express my profound gratitude to what I like to call the ever souped up research team that I've worked with over the last 2 years. Shout out to all of them, but I'm going to especially shout out Frédéric Jubinville, who's our communications multimedia expert that provided input from the dream of the tool to what you're going to see today. Julie Savard, that helped keep the project on track from the beginning to the end, as well as Fiona, Maya, Alicia, Rakaya, Lindsay, and Laura for their insights. And we're also privileged to have several research assistants that worked with us. I'm going to shout out Annelise and Emilie. Both of them helped with the rapid review that identified the need for the PERIPHAT. Casey Knowles and Sabrina and Mackenzie, they worked on a scoping review to identify the changing presentations in primary healthcare, which helped inform the tool. Kelsey Miller, Adrian Barkett, and Natalia Selesky as well. Another shout out to the expert panel members. Without the panel members, we couldn't have done the Delphi rounds. And of course, Health Canada for the funding. The other people we need to acknowledge in this project is CANE, the Canadian Association of Nurses for the Environment. A special thank you to the Water and Air Quality Division with Health Canada, because without their funding, we could not be here. And Université de Saint-Boniface, who provided a reduced workload for myself and Frédéric, and allowed a couple of other researchers, such as Julie, to use that research time for this project. So basically what we're going to be doing throughout the day, well, it's not a full day, guys, don't worry, it's about an hour. So what we're going to be doing today is basically going over like how this project came to be and a little bit of the background in the project, how the tool was developed. We'll tell you the results of the Delphi rounds, and then we're going to play with the tool. And then obviously we're going to talk about next steps, which is one of the reasons why you guys are here. So a little bit of context. So for those of you who work in perinatal period, we know that this time is especially a time where there are numerous vulnerabilities because of everything around the pregnant people. And they're from psychological issues, existential, social health challenges, all related to the stressors of the transition to parenthood. And we also know that the health impacts of climate change can also pose a disproportionate risk to the health of infants, pregnant people, parents, and perinatal families. And infants are especially susceptible with different health threats during these windows of vulnerability because they're little and their bodies aren't able to react to such. So certain things that are changing because of climate change, we can just look at like the extreme heat that we've had in Manitoba, look at the heat stress, the air pollution with the wildfires, emergency evacuations, all those dislocations or the migration because of the different disasters that are happening right now. And when we look at perinatal families that belong to equity denied groups, such as newcomers, immigrants, indigenous peoples, they're more likely to experience compounding and intersecting climate impact change on themselves. So when we look at the Health Canada, the report in 2022, racialized peoples, newcomers, immigrants, and low-income people are more likely to live in urban heat islands and in proximity to air pollution. So for us as healthcare providers and other people who support people during the transition to parenthood, understanding these external factors that can influence the health of the people we work with is really, really important. One of the things that some people know, some people don't know, is what happens when people are exposed to heat when they're pregnant. So if you're exposed to heat for an extended period of time, there's a risk of preterm birth, stillbirth, or congenital health defects. And for us, with more extreme heat events in Canada, it's something to really pay attention to. There's also lots of literature that talks about how air pollution can have an effect on infant morbidity and mortality. And we also know that there's a need to identify and support people during the transition to parenthood who are most vulnerable to these impacts, including but not limited to heat, air pollution, water quality, extreme weather, and evacuation. And we know these are inextricably linked, and that's why it was important for us to include them in the planetary health assessment tool. And in theory, we wanted to make sure to look at the interconnections from an intersectional lens. And we know that people who walk with pregnant people during the transition to parenthood are more likely to be able to identify and are ideally suited to help. So the PERIPHAT creation. So a few of us at CANE, anecdotally, we knew that there wasn't really a point of care assessment tool that looked systematically at environmental risk factors, let alone planetary health. And a lot of the elements of health equity and social justice didn't seem there. So we knew there was a need for the point of care assessment tool. But what we wanted to do was integrate health equity, social justice with healthcare provider resources, incorporated with educational interventions that are tailored to perinatal families that look at issues during the transition to parenthood. So to do so, we did a Delphi study. And for those of you who've worked in public health or in any kind of area that's a little bit less studied, Delphi methodology is a technique that is used to achieve consensus on different elements that may not be as written about in the literature. For example, we chose this to foster discussion and build consensus because of the limitations in the literature. So you can see the different areas of the Delphi process, the problem area. So we did identify it, and I'll mention what we did to get there. And these are the different methods. And so we'll go over that right away. So for the identification of the problem area, we received funding from the National Collaborating Center for the Determinants of Health to conduct a rapid review to check to see what tools are available to assess climate and environmental health impacts on perinatal families with an equity lens. What did we find? Well, what we thought anecdotally. So what we found was the role of healthcare providers is crucial to support perinatal families during a mid-planetary health crisis. We found that in Canada, there are very few practical tools that exist for healthcare providers to assess these impacts with an equity focus. And these tools lack considerations for climate change, pollution, and toxins, hence the need for expansion. So I joke so many reviews, right? Because to be able to finally come to the 7 focus areas that we included in the PERIPHAT, we did the rapid review, what tools exist in the perinatal context. We also did a rapid review that looked at the adaptation and mitigation within the primary healthcare from a global context, a scoping review. Lindsay Colmar conducted a rapid review on extreme heat in children. And in tandem with that, in collaboration with the Prenatal Environmental Health Education Collaborative, we did an environmental scan of the different environmental health education resources and assessed them using a PMAT tool, and then asked healthcare providers what they thought about them. So with all this, we were like, okay, there are 7 focus areas: extreme heat, toxins and pollutions, vector-borne illnesses, mental health, food and water security, climate change, disaster preparedness, and air quality. That felt a little bit daunting. So now that we did the initial prance in literature, we knew that nothing like this existed. We wanted to create something, the joke of going big or go home, right? So now came the point of doing more a systematic search within these categories. So for every single section of the tool, we identified the literature that spoke to environmental markers, impacts specific to perinatal populations, what the key messages were for these populations, like what was the most important thing that they needed to know, what public resources existed, for example, Health Canada, governmental, public health, which peer-reviewed resources existed, and how the public resources and peer-reviewed resources matched up, routes of exposure, and equity considerations. So to be able to create these tables, we had 2 researchers systematically search for the evidence and analyze and synthesize them in these following categories. And then once that was done, we were able to then create the tool. The other things that we wanted to create was something that was online, that was based off the evidence and from the literature reviews, the 7 systematic literature reviews and focus literatures that we did. And we also wanted to have the PERIPHAT to be at a grade 4 reading level. That way, people using the tool could use it without their healthcare provider and have some information, and then they could ask their healthcare provider as well, but also so that it could be used by nurses, midwives, community health workers, social workers, physicians, basically anybody interacting, even like early childhood educators or people intervening in those areas. So once the tool was developed, we had 3 people working in the perinatal area to take a look at it, to see, hey, is this kind of what you're looking and this is what you're seeing, to make sure that the data synthesis tables were point on. And then we recruited panel members, the expert panel, to be able to do the whole process. And this was quite difficult because, one, there aren't as many people that are experts in planetary health and the perinatal area, and then very few were experts in both. So out of 52 potential experts that we identified, and this was basically us doing like a targeted, a very much a purposive like sample to recruit people from. So we looked at university websites, we looked at governmental organizations, basically everywhere that we could, where people had expertise in this area. And we wanted to make sure to include those that had lived experience or traditional knowledge in there. So of the people in our panel, we can see that they were quite familiar with air quality and toxins and pollutions, extreme heat, mental health issues. They were familiar with food and water security, but where we were missing the expertise was vector-borne illness and disaster preparedness. And it's interesting because this actually lines up with the literature, because if we're looking at the familiarity of healthcare providers in this area, it's the exact same way. So we had to like take some of the information that we had with a grain of salt and sometimes reach out to externals as well. Then comes the process of Delphi rounds. So for the Delphi rounds, for those of you who are familiar, basically you usually use a questionnaire, you send feedback, you get the feedback, you summarize the data, you modify it, and then you do this until you receive consensus for the particular question area. So in our study, we only had to do 2 rounds, which to me is like mind-boggling because I was expecting to have to do 5. But after the first Delphi round, overall consensus for the PERIPHAT sections was 77.5%. The highest consensus was for disaster preparedness, heat extremes, and toxins and pollutions. So basically what happened was we sent the questionnaire, we sent the PERIPHAT, they provided feedback. We then collated the feedback, we modified and adapted the PERIPHAT, we sent both of them back, and this was the give and take. So the second round was done last April, and the same thing, 10 panelists, which is the minimum you need for Delphi rounds. So after round one, 4 of the 7 sections obtained consensus. For round 2, all of the sections were between 86 and 100%. And there was consistency of responses observed after round 2, but obviously because of how small of we only had 10 experts, we couldn't actually see the stability because it was only 2 rounds. And then after 2 Delphi rounds, we stopped the rounds because of the high level of consensus and because we also knew that we were going to be doing an optional focus group. So even though we had consensus after round 2, we still integrated the panelists' comments before the final data collection point, which was an optional unstructured focus group conducted last September. And so during this focus group, it was reinforced for the grade 4 literacy so that they can easily understand. And then of the panelists, 5 of them did attend to the focus group. And then it would really help them figure out how it was actually going to look in the end, right? Because this was for content, but not necessarily how the interface was going to be. After the focus group, we decided, hey, we might want to go and see a little bit more when it came to vector-borne illness and communicable diseases. So we enlisted the Public Health Agency of Canada to take a look at it. And one of the reasons why it was a little bit difficult with that is because in Canada, vector-borne disease for surveillance, not all of them were identified at the beginning, but with the help of Public Health Agency of Canada, we were able to complete that. So now we get to play. So now that I've mentioned all this kind of stuff, I would like to invite you guys to go and check out the different sections. So this is what we did to prepare it. And now I want you to go and have fun and pick 1 or 2 by looking at the QR code, take a look at 1 or 2 of the sections and just go through it and pretend you're talking to one of the people you're working with during the transition to parenthood. I'll even put my timer on and then we'll take it from there. Basically, this slide covers kind of the things that we came up. So our tool attempted to look at equity considerations. We could not include absolutely everything in the tool, unfortunately, but we wanted to make sure that the equity considerations that were most important in the perinatal area were identified. So for example, for food and water security, unsecured populations, that type of thing. The other thing I want to shout out is there was a few tools in Canada that do a little bit of environment, but actually integrate equity. So Alberta Health Services has some, the province of Manitoba integrates it, and the reproductive program in Nova Scotia. So they do include some questions that go above like assuming that every pregnant person has all the opportunities financially and that where they live doesn't matter. But those tools, they vary a lot between regions and there's no planetary health perspective, right? So we're not able to consider, for example, the interconnected impacts of pollution, climate change, and biodiversity loss on perinatal health. The other thing as well, one of the things that we continue to notice in the literature is that healthcare providers have no clue how to speak to the people in front of them about these issues because we're learning about planetary health ourselves, and it's just never really been on the radar. I'm not even sure how many of you even had a question of where do you work while you're pregnant? Because that's the type of thing that can actually influence quite a bit the health of your baby, for example. So essentially, healthcare providers have no clue what to say, and pregnant people do not know what to say either, right? And they don't know how to broach the subject. So this tool, what we tried to do was do the knowledge translation beat. So we tried to facilitate the work that you do by collating the best and most up-to-date educational resources in this area to provide you. And if there was nothing created, to at least provide you the best practice based on precautionary principles in those different areas that you could then speak to the pregnant people about. And the other, one of the limitations we have no choice but to admit for this research and the Delphi rounds is because our research team was so huge and all of the research team were experts or considered experts in the area, it kind of limited our pool of experts for the panel. We know that there's a lack of tools, and we know that this is the first rendition of the PERIPHAT and that there will be next steps, but we also need, because of that disconnect between how healthcare providers feels and community health workers feel when it comes to speaking with the the people they work with, we need a more robust guide for healthcare providers. So in tandem with the Perinatal Planetary Health Assessment tool, if you looked on the website, there's perinatal resources, and we're gonna like put a toolkit there that has like further reading for healthcare providers, people who intervene during the transition to parenthood to be able to look at and learn more. So for next steps, right now we're starting a usability study. So that's one of the reasons why it's really cool that you guys are all here, especially with your interest. So for those of you who are interested in saying, hey, I want to use this in practice, we're hoping to get about 50 people who work with families during the transition to parenthood to evaluate in practice. So far, we've recruited 2 health centers that have said, yes, we can come speak to the people that I work with and see how many want to work. And it's a variety, right? So we have people that are interested that are early childhood educators that work in family centers. We have healthy baby sites from access centers who are interested. So one of the reasons the usability study is so important is that even though we did our best based on the available evidence to put what was the essential elements in the PERIPHAT, we know that no matter how much we think these things are important, we also need to know what's feasible and what's doable when you're like boots on the ground. So that's why the usability study is important. And then once the usability study is done, we'll collate that, modify, and integrate the recommendations. And then we're also seeking more funding to be able to translate the PERIPHAT into French. And we also want to create perinatal planetary health workshops or for families during the transition to parenthood. Why that's super important for us is because we know that people during the transition to parenthood, one, they worry about the health of their potential children, and they're also more willing to make the changes, like the health behavior changes, right? So, and one of the things that we forgot to mention was part of the way that the PERIPHAT works is it's based on the theory of planned behavior with motivational interviewing and brief intervention. We're not going to be doing this and asking every single person during the transition to parenthood each and every one of the sections. It's more like, hey, if somebody comes in and says, can I dye my hair when I'm pregnant? You can be like, you know what? Let's take a look at this tool. Why don't we do it together? And then we can see what kind of things are safe, what kind of things are less safe, what you can do to be healthier for yourself and your child, and what kind of things structurally are in place that prevent that. So ideally, what I'd like to see is when people start using the PERIPHAT, let's say they're using it in community, they may be speaking with different families and they've been maybe noticing certain things like, hey, there's no cooling center in my area during heat waves. Well, this is problematic. So how can we respond to that? If there's areas that are prone to wildfires, but the pregnant people aren't prepared for emergencies, right? I'll give the example of Manitoba, where usually we'd be in a flood, but we're kind of in a drought right now. It floods every year, but there's some communities that lose access to get to the hospital. So how can we prepare these pregnant people to be able to still do what they need to do? All right, so time for questions. So I'm not sure where to start for the questions. I don't know if you want to.
Well, there's a few in the Q&A.
Okay, so do we start with the Q&A or do we start with the chat?
Maybe just from the Q&A, because sometimes some of them have been there a while. I know that you had mentioned there was a question about that you have answered to, but about BC Perinatal Services and if we would be partnering with them to integrate the PERIPHAT into their PSBC Hub website and into perinatal education for nurses in BC. So that would be great to set up a meeting with them to see how
Yeah, for sure.
how that can be addressed as well too. And then, so I know that you've answered some of them. I don't know if people had a chance to see that as well too. Okay, so those questions have been answered. So maybe we can go to the chat then.
Okay, sounds good.
And I know there was one about whether ethnicity. Do the questions regarding from Melanie? Do the questions
Ethnicity,
regarding
income.
ethnicity,
Yeah.
income changes, the results are listed at the end?
Yeah, so they do. So depending on what you answer, like income-wise, it's going to change the information in the education you give, right? So especially like for certain sections, especially like for the food and water security, that does impact what you're going to be telling them. So we're not, the questions aren't just asked to be asked, they're also to try to find resources that can add
Will be
can go
tailored.
with,
Yes,
yeah,
yeah.
to be coherent with their particular situation. For if
Other languages, translation to other languages.
I wish, right? So we only had so much funding, and I think we're already out of funding for this project. So the rest is basically volunteer hours from like the people who have research time at work, but that's how research is, right? There's a plain language under grade 6. So that's a really valid question. So one of the things that I forgot to mention in the tool is as you're going through the tool, if something has several syllables, it'll be highlighted in green. And if it's in green, if you hover above it, the definition will be there. So sometimes we couldn't put a word that had less syllables, but we did have it checked for plain language. And if anything was a little bit more difficult, we made sure to have like a definition box so that they knew what we were talking about.
And have we considered asking community organizations for feedback on the tool?
We have, and that's something like for the usable study, it would be great if if there's community organizations who would like to participate in the usability study, come say hi. We would love to have your feedback.
And to contact you with your email that you gave earlier. Maybe I can put it again in the chat, maybe just to make sure that people have that. Is that okay?
For sure.
We just got a question in the Q&A. Do you have any other knowledge mobilization plans?
We do. So far for knowledge mobilizations, it's really been like we've presented at in New Brunswick to kind of introduce the PERIPHAT. We're doing this webinar, but basically a lot of the knowledge mobilization has been through we're going to be doing through the Community Health Nurses of Canada, another presentation. And we also are open to be able to we'd also be open to like meeting with other organizations. So for Mélanie, pour la version en français, en ce moment, un de nos partenaires, c'est un organisme bilingue au Manitoba. Et puis, à cause qu'ils sont bilingues, nous allons probablement faire traduire au moins les questions en français. Puis ensuite, l'éducation que nous avions, puis nous donnons aux personnes enceintes en français, mais nous sommes en train de trouver les fonds pour faire la traduction avec Santé en français dans la province du Manitoba. So, si ça se fait, Mélanie, on peut potentiellement même faire des rencontres un petit peu plus tôt. La difficulté avec ça, c'est que quand on crée quelque chose en anglais, on veut que ça soit validé de nouveau une fois que c'est en français. So, vous auriez l'outil un petit peu de l'avance, mais ça ne serait pas l'outil validé. So, the question for translation, one of the reasons why we didn't just start the translation and launch it in both languages is because coming from a linguistic minority setting, there's nothing worse than people thinking that just translating is sufficient to respond. You have to go through like a validation process in the other language to make sure that it is usable and it works, right? Because there's nuances. And even when it comes to language, one of the things that I found when you're creating resources is the different level of the changes in the way people speak French across Canada and the regional nuances has to be taken into consideration as well.
So a question from Shari Rose about the general questions. Do they have to be on the front page so you don't have to go to complete this every time you go to a new area? Because
so that was something that we were hemming and hawing about, right? Because the idea is most likely you will not be doing this questionnaire, all 7 of the sections at the same time with the pregnant person in front of you. So if you are a healthcare provider working with the pregnant person and you've already had them, you can answer those questions already. But it's just like if you're speaking with somebody like when they're desiring to become pregnant, you ask those questions, things might change by the time they're 6 months pregnant when it comes to like housing and stuff. So we put them in front of everyone because the idea is it's not like a let's do all the sections at once. It's more of that if the conversation comes up. So unfortunately, that's not something that we can skip, and the background might be a little bit different. I think for the little and the middle and low income, it's more of a perspective, right? So like, and that's one of the things where for us, it's more the perception of how somebody feels, right? So somebody might be food insecure and have difficulties purchasing food because they weren't realizing that the housing market would do what it did, right? And so with the interest rate that was at 2%, they were fine, but then when it jumps up to 6%, now they're having a hard time. So we didn't want to actually put the numbers. We wanted to see, how do you perceive, right? Because somebody who is low income but doesn't think they have any issues with purchasing food, like the issue is more, do they have what it takes to actually purchase what they need? Barb, with the Canadian National Perinatal Research Meeting is occurring, that would be great. If you have somebody that is in, like at the Canadian National Perinatal Research Meeting, that would like to connect with us, that would be amazing. Like I would love to connect with them and present with Kaplan. I don't actually, for somebody who works in perinatal so much, I don't have as many connections because I've always done like the community aspects. Any other questions?
We've had a few comments of feedback, which is great because it'll give us a chance to review it before we can update it. There's a few issues on the mobile side, so I'll see if I can adjust them so that they're a bit more
Okay.
manageable.
That makes sense. So with the accessible beyond the online, that's where we are working. So for example, with Nunavut and Northwest Territories, where notoriously there's different accessibility issues, we are figuring out how we can do like a shorter version where we have like binders with the resources of choice with like questions, but that is like next steps in the next round of funding. It does seem like there might not be any more questions, which is lovely. Honest to goodness, I love talking about this topic. So like if you want us to come and speak, if you have ideas on what we can do to do better, contact us. If like your local public health unit, etc., let us know, and we can definitely come and even connect with you guys individually, because that's part of the knowledge mobilization plan is this. So actually doing presentations or webinars for the community health centers, or even early childhood centers, right? Like if you have a family center that you're working with pregnant people and little ones, healthy baby sites, that would be a good thing. I'm thinking about families first workers as well. All right, awesome. Thank you so much. Thank you, Fiona. Thank you, Frederic. And thank you everyone for attending today. We appreciate you. And feel free to connect when you have a chance.